All right, so we're looking at the various investigations you might actually do for patients with acute kidney injury. So for these various investigations, we are just trying to look at, yes, I actually have a patient with acute kidney injury. So what test can confirm that yes, this patient actually has acute kidney injury? Now, looking at the test, you can also try to say, okay, yeah, mostly the test though. Okay, what test? Okay, what lab test, imagings? Do you understand that kind of thing? So investigating a patient with acute kidney injury, it involves a strategic mix of clinical assessment. So you are trying to actually, get some information from the patient that will help you to confirm that the patient has an issue. You are trying to do lab tests. You are trying to do an imaging of the kidneys to look at the anatomical structure of the kidney. So for the lab test, things you actually need to do is you check out for what? Renal function. Okay, renal function test. So serum creatinines, blood urea nitrogens. Okay, they also estimate the amount of fluid that the kidneys are able to filter out within a given time. That's the estimated glomerular filtration rate. Then for electrolyte and acid base status, you are just trying to look at all those electrolytes in the body. Are they high or are they down? So serum potassium, sodium, calcium, phosphate, bicarbonate, arterial blood gas. You are trying to look at all of this and see their levels in the body. Okay, of course their levels should actually give you an idea of you trying to know how much of the you trying to know how much of the function of the kidneys is still being retained. The complete blood count is also a thing there. You also do a testing for the liver functions. So urine studies, you also take out some urine directly, then try to study it. Okay, urine microscopy, you are checking out for crystals, cast cells, or bacteria or virus. Do you understand that kind of thing? Urine osmolality, then urine sodiums. So for imaging studies, you do renal ultrasound, bladder scans, CT scans, Doppler ultrasounds. Then you also can do some specific tests where you are looking at the autoimmune levels, you are looking at renal biopsies, you are looking at complement levels. Okay, so this is what we have here for the different types of tests that you might actually want to do for a patient that has acute kidney injury.